Good morning, everybody. Today is March 31st, 10 a.m. I'm Dan Spencer from the Bellingham Board of Selectmen with our daily coronavirus update. I forgot how to say it. I'm going to defer to Deputy Chief Mark Poirier for his update.
Good morning, everyone. Thank you for joining us. I'd like to just go over some of the cases for the state of Massachusetts. As of yesterday, there were 5,752 cases, 56 deaths, and 797 new cases. The total for U.S. as of yesterday was 164,378 cases, and we had 3,163 deaths. We had a conference call yesterday with the governor, the senator, and the state rep, and they're predicting that April will be should be our peak of the coronavirus. So I would like everybody to plan ahead and be prepared for that. Practice your social distancing. Make sure we're ready for this peak that the governor, the senator, and the state rep are calling for. If you have any questions regarding anything from Massachusetts regarding the coronavirus, you can call 211. Also, the Attorney General has a phone number for any work-related questions. You can call the Attorney General at 617-727-3465. And I just want to update everybody that this is not a substitute for Code Red. We will continue sending out Code Red messages when we want to provide some updates to you. So don't think that this is the only means of communication. We will send out Code Red. Thank you very much.
All right, so as I said during previous meetings, the whole purpose of these broadcasts is to keep everybody in Bellingham updated with the most recent information and the most accurate information. What we're going to do is bring in various department heads to give you an update on what their coming and goings are, and opportunity to field any questions via email at covid19@bellinghamma.org. So today we have our library director, Bernadette Rivard. You want to come up and give us an update?
Good morning, everybody.
Good morning.
The library's been closed this is our second or third week to the public. Our staff is working remotely, and we are able to assist residents by email or voicemail. Our email address is library@bellinghamlibrary.org. Our voicemail line is 508-657-2776. We will answer within 48 hours, but often we're able to answer within just a couple of hours. We ask that you please keep any library materials you have checked out until we reopen. Our book drop is locked. There will be no fines or late fees for any items that you have checked out during this period. We also ask that you please not drop off book donations at the library while we are closed. We've had some people just dropping donations off. Our book sale is canceled for the spring, and we really just don't have a place to store books, so please do not drop off book donations. Updates on our services are on our website, which is bellinghamlibrary.org. Click on the red alert banner that says remote services available while we are closed for the latest updates. Mr. Steve is continuing to provide story times and other programs by video that we are posting on our Facebook page. If you aren't a Facebook user, links to the videos are also on the website alert. The website alert also has links to electronic resources that you can use from home during this time. You can download ebooks, magazines, music, online courses, learn a language, and so much more. I know many of us are looking for distractions to help us, and these resources are a great way to learn something while we're in this new paradigm that we're in. If you don't have a library card, email us and we'll get you one so you can access these services. We are also distributing a weekly newsletter to update residents. The weekly Wednesday is sent out on Wednesdays with all library updates. If you click on that alert on the website, there's a place for you to sign up to get those email alerts. Again, please email us at library@bellinghamlibrary.org or call 508-657-2776 and leave a message. If you need any assistance with library services, we're happy to help you.
Great. Thank you very much, Bernadette. All right. Next, we have connecting via remotely our superintendent, Peter Morano.
Hi, everybody. So our schools are closed for the month of April. we look to, as of right now, reopen on May 4th. Our teachers and staff are working really hard to provide enrichment, but also additional content in the coming weeks. So starting on April 6th, they'll be doing more remote learning, along with pushing out additional content for kids. So that's the plan so far. That's the part of the advisory we received from the Department of Education. Some of the things that are kind of lingering for us right now are April vacation. We're not sure if that's going to be something that we work through or take off. Again, I'm waiting for the state on some advisory. Also MCAS. We're waiting to hear if that's going to be pushed off or canceled for this school year. That's still up in the air. Our custodians continue to work in our buildings. They're continuing to sanitize and clean, but also doing some summer work that will help push them ahead. And then our cafeteria workers are in the buildings on Mondays and Wednesdays, so they're providing meals for kids who are eligible for free and reduced lunch. They can pick up, on Monday, they can pick up 2 meals for Monday and Tuesday. It's breakfast and lunch. And on Wednesday, they can pick up 3 for the week. So they'll have 5 breakfast and lunch meals for the whole week. If anyone feels that they're eligible for free and reduced lunch, please fill out the form. It's on our website, and we'll get that information back to you if you're eligible. And then you can participate in the program. I mentioned it earlier that there'll be new content that's pushed out next week. It's really important for our kids to know that they need to work during this time. There's going to be schedules that their teachers are going to put out. There'll be abbreviated instruction, but also things that they need to do at home. Moving forward, your classes will become credit, no credit, pass, fail. So, teachers are cognizant of the challenges of doing this from home and want to make sure everyone have access, but there will be work that needs to be completed. So that's basically the update from the school side.
Thank you very much, Mr. Morano. Just a quick update from last night's Board of Selectmen meeting. The board had voted to change the dates of our local election and our town meeting. So our local election will now take place on June 9th, Tuesday, and our town meeting will take place on June 22nd, which is a Wednesday. Along with changing those dates, go some additional work for our town clerk. So, Mr. Sposaro, if you want to come up and kind of address what changes are going to be in effect because of those dates.
Morning. We have been voted to take the town meeting. They were able to do that by special legislation during this crisis. So it actually worked out that we were delayed about a month. So in that case, the last day to register to vote will now be May 29th. And it's a Friday, and we will bring you news on the hours if anybody needs to come in. We have to have in-person hours according to the state. However, there are many other ways to register. You can register by mail. You can request, send us an email if you'd like at townclerk@bellinghamma.org to get a registration card in the mail. And you can also register online. And we're still actually in the office registering people to vote when it comes through any of the agencies or any online registrations. So that's all available to you. And as the date draws near for the election, there are some other options that we might be able to exercise to make voting easier for you. And I will bring you up to date on that as I said, as the date draws near. Thank you.
Thank you, Larry. Bruce, did you want to give an update, or we just want to go right into the questions and you can address the questions?
We'll go
right into the questions.
One of the prevailing themes of several comments from health professionals out there was that we need to do a better job of practicing social distancing during our meetings, and we're thinking about it, and it's all something that we're all getting used to, keeping our own distance and making sure that we're not putting our own things on a table and then picking them up and then having somebody else put theirs down. So good comments, and we certainly appreciate those. We've got a few nurses out there that are keeping a close eye on us, so thanks for those comments. Bernadette, we did have one question, and you may have addressed it in your remarks. If you did, I'm sorry, but people are asking what to do about library books that are due.
Yeah, there's no fines. Hang on to them until we reopen.
no fines, hang on to them until they reopen. Right. We had a few questions for our public health nurse. Esther Martone is a public health nurse, works closely with the Board of Health. And during this particular crisis, we've learned how invaluable those services are. And we certainly appreciate Esther has been spending a lot of time with the town of Bellingham, trying to keep us safe, tracking cases and being our sounding board for a lot of the questions that come in. And one of the questions that we had come in yesterday was, how does the virus respond to food items that may be put in the freezer?
So the research doesn't have any specifics in regards to how long it lives in a cold environment, but it is recommended that any food items you bring into your home that need to be immediately refrigerated or frozen be wiped down with a mild soapy solution and then dried before you put them in the fridge or the freezer, like your milk gallon or your frozen vegetable packages.
Great. Another question for Esther. Are you able to tell us if an employee at a takeout restaurant becomes positive for the virus? So they're asking, for instance, if a restaurant, whether it's a driver or somebody that works in a restaurant, tests positive, is there any information that's provided to the public?
So the only way I would have access to that information would be if they were a resident of the town, number one. Number two, they are still protected for their health information, so that information would not be made public. However, like in previous cases of positive coronavirus, you would be notified if you were exposed to the virus and at risk for contracting the virus.
So how does that happen if I'm receiving a delivery for a takeout order and that person turns out to be positive? You do some tracking and then notify me, hey, Dennis, you received a delivery last Tuesday and the driver turned out to be positive for corona?
Basically, I wouldn't be able to tell you who was positive, but I would be able to tell you the day and that you were exposed to a positive case. The best recommendation is once you've taken your container from the delivery person or when you've gone to pick it up, wash your hands before and after you eat. That's really going to be key, because if the virus is on the container, you washing your hands for that 20 seconds is going to get rid of the virus, and you're going to have less risk of putting that into your mouth.
Can you touch on the mail again? I know we talked about it yesterday.
Sure. So the current data still suggests that the virus can live on paper and cardboard for up to 24 hours. So you just want to wash your hands before and after you're touching your mail. Make sure you're not touching your face. You can leave your mail or delivery packages alone for 24 to 48 hours, and the virus would die off of the paper or the cardboard at that point.
Great. Thank you, Esther. Anything that you wanted to give us as an update?
So we did have one new case come in overnight. In the grand scheme of things, one is not horrible compared to the local towns. Again, all the positive cases are doing really well with isolating once they start to feel ill. So there has not been broad exposure within the town at this time. Even though the cases are spread throughout the town, it really is not linked other than the household contacts.
And that's really a tribute to the people that live in town. I know a lot of us live
Correct.
in town, families in town. When you drive around, you see that people really are practicing all the things that we're talking about here and what's being emphasized at the state and federal level. And it's really a credit to the residents of this town. And we can't thank them enough. Even going into the grocery stores, people are paying attention and trying to maintain social distance to the extent that they can. So we're keeping an eye. We're keeping an eye on the playgrounds, and we heard reports about the walking track. A lot of people are walking at the high school. Evidently, we're going to try and discourage that as much as we possibly can. We know it's not easy, but it's really a credit to the community as a whole. I think that we've been able to limit the number of cases to the extent that we have.
Definitely. And again, if you're not feeling well, stay home. If you don't know what it is, if it's allergies or a cold, just stay home. Don't expose anyone else to whatever you may have.
Thank you, Esther.
You're
Few
welcome.
more questions that we have, not health related. Given everyone is staying at home, is there a way to have an additional trash pickup day? Or could additional trash bags be provided from normal pickup days to account for the increase in the amount of trash per household? Thank you. We do have a contract with our trash provider, so it would be difficult without being assessed additional fees. And right now, additional trash bags are available at the DPW. There is a charge for those 5 bags for $15, and those can be used for additional waste. We still have a ways to go, at least another month to 6 weeks, I think, anyway, before we finish up with our lockdown. So I know it isn't easy for those that are generating additional trash. We will look into that further with our hauler, but right now we are limited with the amount of trash that we can put out without the excess bags. And the excess bags, again, that's contractual with the trash hauler. They bid on our contract based on the amount of tonnage that they expect we're going to generate. And obviously, right now, there's more trash being generated due to the fact that everybody's at home. Another one we had about the fact that we've got a rotating schedule at the DPW. We've had a couple of questions with regard to that. And really, it came to light a week ago when we had 9 members in the DPW that were out potentially ill with the virus. We had 7 that were exposed, another 2 that were quarantined because they were sick. And what we've done is, what just about every other community has done, is gone to a rotating shift to avoid losing the entire department. We have critical facilities in the DPW, which include 2 water treatment facility plants that are checked and monitored every day, along with 12 wells. We have pumping stations, so we need to make sure that we try and keep our employees from getting ill, and those that are not involved in essential services in any day aren't working. They're working from home. They're on call, so that if something does come up, they can respond immediately. And Esther, I don't know if you can touch on that. I think most communities are looking to adhere to a essential services type of personnel working on any given day.
Definitely. You want to keep the people separated as much as possible, especially in an environment where social distancing may not be able to be done, small confined spaces, things of that nature. So working on a split shift is a really good thing to make sure that we do have staff available if things arise.
Sure. Thank you. Another question was about if we have food that we want to donate. There is a food pantry. My understanding, a food pantry across the street from the middle school. I'm going to ask Bruce Wilson, our health agent, was that just permitted recently?
I just did issue a temporary food pantry permit to the outfit. Any food that's contributed needs to be, non-perishable, canned goods or stuff in packages. Be conscious of the expiration dates, but they are accepting and passing out to families that need it.
And that food pantry is the old ice cream shop across the street from the middle school. And I'm not sure if Loaves and Fishes, the food pantry that works out of the same place, is still functioning or not. They are still functioning. Yes. So there's 2 places. If you have food that you'd like to donate, either one, you could drop food off. Thanks, Bruce. And I think the final question we had was one of great concern yesterday, was with regard to the 14-day quarantine that the state of Rhode Island put in place. But that's more of an advisory. If you're traveling to another state, chances are they're going to advise you to quarantine yourself for 14 days if you're going to be residing there. People were concerned that they wouldn't be able to continue shopping in neighboring Woonsocket or neighboring Rhode Island, but that's not the case. It's doctor's appointments, pharmacies, etc. They're just asking if you're going there to observe a 14-day quarantine, if you're going to be living there. That's all that I had.
All right, so the last couple items here. The recycling center is open for yard waste only. It's from 9 to 2.
9 to 2.
9 to 2, Tuesday, Wednesday, and Thursday, correct?
Correct.
Again, yard waste only, so please don't bring other recycled goods just for yard waste. We had a request to get it open. A lot of people doing the yard work while they have time and they have no place to put it, so we did manage to get that open. But again, yard waste only. Make that clear. So again, these broadcasts are an attempt to keep the residents of Bellingham informed and updated with the most accurate information we have. Based on the questions that we field, we're going to invite different department heads and different group leaders in. So tomorrow,
Special guest.
we have our fire chief and our police chief will be in, either in studio, if you will, or via the Zoom platform. So if there are any questions that you may have regarding the fire department or the police department, email them to covid19@bellinghamma.org, and we can certainly get them addressed tomorrow. Other than that, everyone stay healthy, wash your hands. Thank you.
Thank you.